When a tooth is removed and not replaced with a dental implant, bone loss begins to occur. Because the bone is no longer stimulated by the tooth's root, the body's natural resorption process causes the bone to deteriorate. Depending on where bone loss has occurred, a bone augmentation or a ridge preservation procedure may be an option to replace missing bone and eventually replace your missing tooth. There are several ways to replace the bone so that the jaw is able to support a dental implant. A bone augmentation or bone grafting can replace the height and width of the jawbone where bone has resorbed. If bone loss occurs around a natural tooth, a bone graft may be performed with small bony particles. Depending on each patient's needs, a membrane or medication may be used. The bone graft materials will be left to heal and provide the tooth with extra support. When a lot of bone is missing, a block graft may be used to replace the missing bone. The blocks are shaped to the area that is missing bone and is secured with titanium screws. This graft is left to heal for a few months, and the screws are then removed. The bone is now ready to support a dental implant. A ridge preservation or socket grafting procedure is used to fill the empty space in the jaw left by a tooth that is extracted. A tooth is removed, and bone grafting material is placed into the space. Sometimes, a membrane or a medication is placed over the bone material to help promote the healing process. Many times, the bone is left to heal for a few months, and a dental implant is placed when your doctor determines it is ready. For all of the procedures, the bone material may be your own bone or bone from a donor source. You will consult with your doctor to decide which option is right for you.